My name is Samira Makit. I'm a second-year internal medicine resident at Medical City Fort Worth, and today I will be presenting a case of transverse myelitis following COVID-19 infection. Transverse myelitis is an acute or subacute inflammatory spinal cord myelopathy, resulting in motor, sensory, and autonomic impairment below the level of the lesion. Transverse myelitis can result from a variety of etiologies, including parainfectious, drug or toxin-induced, autoimmune, paraneoplastic, or idiopathic. Since the emergence of COVID-19, little is known about the long-term neurologic complications of COVID-19 infection. Here we discuss a case of transverse myelitis following COVID-19 infection in a patient without predisposing risk factors. Our case is a 40-year-old male with a history of migraines and no recent travel or trauma who presented with sudden onset lower extremity weakness for 2 days. Symptoms began with lower extremity paresthesia, which gradually ascended to the level of the abdomen. Weakness progressed to paralysis, with him being unable to ambulate. He reported urinary retention with involuntary leakage of urine. The patient admitted to testing positive for COVID-19 2 months prior to presentation. On examination, the patient had 0 out of 5 strength in the bilateral lower extremities, loss of sensation below the level of the diaphragm, and absent lower extremity reflexes. Spinal MRI demonstrated T2-weighted hyperintense signal within the central gray matter within the lower cervical and thoracic spinal cord, and right temporal white matter lesion consistent with transverse myelitis. CSF showed lymphocytic pleocytosis with elevated protein. Testing for HSV, VZV, HIV, RPR, West Nile virus, CMV, EBV, and oligoclonal bands was negative. He was started on empiric acyclovir and pulse dose steroids for 5 days without improvement in symptoms. He was then initiated on plasmapheresis for 5 days with return of motor function of the toes. He was discharged to a facility for long-term rehabilitation. As more studies are done on the long-term effects of COVID-19, increasing numbers of neurological complications have been reported. Proposed mechanisms include direct viral invasion and replication in the spinal cord neurons via ACE2 receptors, and inflammatory cytokine response and complement activation following infection, resulting in demyelination. A systemic review analyzing 20 cases of transverse myelitis following COVID infection demonstrated male predominance of the disease with a median age of 56 years. Neurologic symptoms manifested days to weeks following infection. Treatment with steroids showed good outcomes, with 90% of individuals recovering either partially or near fully. Interestingly, our patient demonstrated poor response to corticosteroids, but showed improvement with plasmapheresis. The efficacy of plasmapheresis in reducing morbidity in patients with post-COVID demyelinating disease has not been well studied. Increasing evidence has demonstrated a link between COVID-19 and transverse myelitis. Early diagnosis and management results in favorable prognosis. Therefore, it is important to consider transverse myelitis in patients with a history of COVID-19 that present with neurological symptoms and to pursue early management to avoid complications. Thank you for listening to our presentation.